Hello, everyone. Welcome to my remote collaboration and evidence-based care video for Nursing 4030, Making Evidence-Based Decisions. My name is Michelle Driver. In this video, I will be using the Villa Health scenario provided by Capella University. The purpose of this assessment is to propose an evidence-based care plan to improve patient safety and outcomes, explain how evidence-based practice model was used to develop the project, reflect on the evidence that was most relevant in helping make care plan decisions, and identify the benefits and strategies for the interdisciplinary collaboration with a remote team. Introduction. Caitlin is a 2-year-old girl admitted to the Valley City Regional Hospital for pneumonia and malnutrition during her 6-month checkup. She was brought into the emergency room last night by her mother. The child has a past medical history of pneumonia and was born with mecolium ileus. Auscultation of the lungs revealed decreased breath sounds at the right lung bases and rhonchi scattered in the upper lobes. Her respirations are 32 beats per minute and her breathing is shallow. Caitlin is running a temperature of 101 degrees Fahrenheit. The child weighs 20.7 pounds and her extremities show a decrease in subcutaneous fat. A sweat chloride test was done and the results were 65 milliequivalents per liter, which confirmed a cystic fibrosis diagnosis. Caitlin's medical presents many challenges for the Bergen family. The hospital is an hour away from where the family lives. The area is in rural and the roads are dangerous to drive on in the winter. Like Caitlin's situation, all parents of children with cystic fibrosis must utilize hospitals and the healthcare system, which is made more challenging in rural and remote places. Jessup et al. 2017. Her small town has minimal resources for treatment and education of this diagnosis. The child's mother and father are still married but legally separated, and both parents work very long hours. Money is also an issue as the father just started a new job after being unemployed for a long time. The family must comply with the treatment regimen to ensure that Caitlin's condition doesn't get any worse. It is especially critical because the child's age and she cannot do the huff breaths. Dr. Benjamin, Caitlin's pediatrician, discloses to Dr. Copeland, the pediatrician at Valley City Regional Hospital, that he has never treated a patient with cystic fibrosis before and does not have telemedicine access in the facility he works. Using evidence-based practice, I will be assisting the interprofessional team in formulating an effective care plan to improve the safety and prognosis of Caitlin's newly diagnosed condition. Dr. Copeland, the pediatrician at the Valley City Regional Hospital, recommended various treatments for Caitlin. The orders included a nebulizer, aerosol treatment, and chest physiotherapy to help with breathing, a high-calorie, high-protein diet, and keeping an eye on symptoms at home. Cystic fibrosis requires lifelong pancreatic enzyme supplementation, a high-calorie and high-fat diet containing 35 to 40% and fat-soluble vitamins and trace minerals. Nerig and Alt 2017. Since Caitlin is malnourished because of her condition, providing her with extra calories is essential to promote weight gain. This resource provides the necessary evidence-based information to promote better outcomes for Caitlin. In addition to the dietary supplements, Dr. Copeland also recommended respiratory interventions to facilitate with clearing out the lungs. Respiratory hygiene is crucial to patients with cystic fibrosis. Since Caitlin is too young to clear secretions with huff breathing, Dr. Copeland prescribed aerosol nebulizer treatments. An article by Petrolio et al. In 2020 states that the nebulizer takes time and nebulizers must be cleaned and disinfected. In addition, nebulized medication only works when appropriately inhaled. Because of Caitlin's age, it will be challenging to get her to inhale all of this medication. Furthermore, Caitlin's family will be responsible for maintaining the nebulizer. Improper use and maintenance and poor disinfection can lead to bacterial and fungal contamination, Petrolio et al. 2020. When assessing this care plan, it would be helpful to know who participates in Caitlin's care so that they are able to be educated on her disease, its symptoms, and how to give treatments as necessary. Evidence-based practice model. The evidence-based practice model is used to develop Caitlin's plan of care was the Knowledge to Action model, KTA. The KTA model works best because it can be used with teams and individuals. The main focus of this care plan was to help Caitlin's family manage her chronic illness. The KTA framework was developed in the early 2000s to improve transferring knowledge to action. The KTA framework consists of two components, the knowledge creation and the action cycle, each with multiple phases. Once the information is moved from the knowledge creation, people look for answers that may arise. Education tools such as pamphlets and websites are useful tools to help guide their research and identify barriers to transition into the action cycle. The action cycle includes putting what you learned into action. For example, Caitlin's healthcare team can use their knowledge of evidence-based practice to learn more about her newly diagnosed condition. Interdisciplinary collaboration challenges. Interdisciplinary collaboration challenges may arise during patient care. Since Caitlin's family lives in a small town, they must rely on telehealth to avoid a potentially unnecessary commute. With limited resources, telehealth will be a challenge to the Bergen family. To help the Bergens with their challenges, the Valley City Regional Hospital healthcare team is willing to communicate with the family and their pediatricians through text messages and Skype. By using telehealth, Caitlin's parents can share with the interdisciplinary team without having to do it in person. Conclusion. Caitlin's newly diagnosed CF diagnosis is a chronic illness that will have lifelong effects. Because of the nature of this condition, coupled with Caitlin's young age, it is up to her parents to determine the outcome of her care. Telehealth can help the parents communicate with the healthcare team without traveling far and alleviate costs because the parents do not have to miss work. Thank you very much.